One of my patients was a 26-year-old pregnant for the first time. All of her prenatal labs were normal, with the exception of her vitamin D level, which was low, and her preterm test came back at 6.3 times elevated risk. So she falls into the higher risk category. I think having the information from the preterm test helped her to focus on the fact that she needed to pay attention on a daily basis. She wasn't just growing a baby, right? She wanted to grow a healthy baby. On my side, there were little things that came up along the way that I may have ignored had we not had those preterm results. At 34 weeks, her blood pressure was slightly elevated. It was 130/90. Not typically high, but it was a little different from where she had been. Just knowing that she was at higher risk for a problematic pregnancy, we sent off a set of preeclampsia labs. These came back normal. A growth scan was done at 35 weeks and surprisingly showed us that the baby was at the 14th percentile for growth. That was a surprise because mom had gained 35 pounds to that point in time in the pregnancy. She returned the next week at 36 weeks and 3 days for another growth scan. Now the baby had dropped to the less than 10th percentile for growth. Consultation was requested with a maternal fetal medicine specialist who recommended delivery at that time. This baby was born weighing only 1,900 grams. It had no other problems. It was breathing well. They actually allowed her to try to breastfeed this baby, but it had to spend about 10 days in the NICU. During that time, it really required minimal support, but this is what we would call a grower and a feeder. And this baby went home with its parents when it was 10 days old. This could have been a stillbirth. We were very fortunate to catch this one when we did. And if I didn't have that high-risk result constantly looking at me on the front of her chart, it would have been an easy one to miss.